Assalamu alaikum, guys.
Waalaikumsalam.
Thank you so much for being here today. Really appreciate the opportunity to talk a little bit about the great work that you guys are doing. My name is Firaaz Azeez. I'm the Executive Director of Humanity. And we're really thrilled for the opportunity to work with Smile. I'm hoping today will be an opportunity for us to really talk about the great work you're doing, maybe dispel some myths around the fact that we live in a first world country and yet we have newcomers who have, no or very little or no access to supports when it comes to services, mental health, and the like. And so I thought maybe we can start with maybe just introducing yourselves. That'd be great.
Thank you. Thanks for having us. It's always wonderful to have such an opportunity to, one, dispel myths, but also share the wonderful work at Smile Canada. My name's Sukaina Dada. I'm the Executive Director at Smile Canada. I'm also a pediatric occupational therapist and a researcher in disablement and displacement.
That's a lot. We'll get to that.
We'll get to
Absolutely.
that.
Welcome.
Assalamu alaikum. My name is Raian. I'm the Director of Service Navigation at Smile Canada. So my main role is to support our families at Smile. I manage our service navigation team, which is a team of 7 wonderful service navigators who speak the languages of our families. And my main focus at Smile is to make sure that we're providing culturally responsive support and guiding our parents through our families through every step of the way in their journey in Canada. I have a background in psychology and early childhood mental health, and anything social justice and disability related.
Amazing.
Yeah.
2 very accomplished young ladies. It's awesome. So tell me a little bit about how long you've been with Smile, a little bit about the organization.
So I founded Smile over 15 years ago.
Oh, congratulations.
Thank you. And, it started off like a club. Like we were a group of us. We wanted to do something. We saw a need in the community. For myself, I had some lived experience. I actually had convinced my cousin who has cerebral palsy. He was very young at the time, living in Tanzania. And I convinced his family to bring them to Canada because I said, in Tanzania, he wasn't getting any supports, but in Canada, he's going to be able to go to school. He's going to develop social relationships. He's going to have all kinds of support. And I didn't know that it wasn't going to be that easy. So when the family migrated to Canada and, we said, okay, let's get started. Let's get him into all these different services. There were not a lot of services and many things were out of pocket and we didn't know that was the case. And so we started talking to other families and we found that many newcomer families were experiencing the hurdles that we were experiencing as a family. So fast forward a few months, a few years, and Smile emerged. And then in 2015, we decided to make it an official charity. And since then, alhamdulillah, we've just seen a lot of growth. And now we're at over supporting on a daily basis, a weekly basis, we support over 750 families locally.
Wow. That's amazing.
Yeah.
So, that really, it was a personal thing for you.
It was a personal thing. Professionally, I went on to become a pediatric occupational therapist because I wanted to work in the field. I wanted to work with kids like Muhammad. And then, about 7-8 years into work, I realized that I really wanted to also look into the policies around newcomers with disabilities. So I pursued a PhD in the study in health policy at York University, specifically on the intersection of disablement and displacement.
That's amazing, Sukaina. Congratulations. I think it's wonderful. So, from a personal experience, you saw a need and you pursued that passion and here we are, right? So Smile's been around, is it 15 years?
15 years. Yeah.
Wow. And what's, before we kind of get into how the organization works and that kind of stuff, it's just high level, what have you seen the impact for Smile?
So, Raian and I are in a unique position because we can see the direct impact, which is always really nice. Every time a family shares that they got access to funding because one of the service navigators supported them, or when we see the impact at a local level on a parent support group that supports, children with long-term illness in critical units at the hospital, the impacts of these little narratives That actually is what we pay most attention to. However, on a grander scale, we've also seen some of the impact of our advocacy in terms of, cultural responsiveness, cultural safe practice, working with newcomers, having agencies, examine the ways that they work with newcomers to become more inclusive. That, of course, is also a direct impact that we pay attention to. But I think the thing that stirs us the most or encourages us the most are the direct impacts from families.
I mean, you said impact a few times. As you know, Humaniti is all about impact,
Yes,
right? As a global nonprofit, I mean, really, where we come in is to be able to, work with agencies and partners who are having direct impact on the lives of a child, an adult, a family, a community. And so I think that's one of the attractions for us, right? To support. I mean, we're thrilled, first of all, that Humaniti is supporting Smile in a very small way. It's a bit of a pilot for us to kind of see how we work. And I think one of the things that attracted us to us is the fact that you are having that direct impact. So, I mean, you alluded to it, and we'll get into that a little later. So tell us a little bit about how Smile works.
Do you want to take
Sure,
it?
absolutely. We can tag team.
Yeah, for sure. We have a lot of teams at Smile, and we do a lot of different things. So I think two of the major teams that provide the most impact are the service navigation team and the research and education team. When it comes to service navigation, our families are referred to us from many different sources, whether it's a settlement agency, a hospital, a clinic, a family doctor. We actually get a lot of our referrals from the major disability and critical illness hospitals and institutions in Ontario. Any family that they see that falls within that racialized, Muslim, refugee, immigrant criteria gets referred to Smile Canada because they know they don't have the resources to support that family. We do something called a needs assessment that's non-diagnostic, just to learn a little bit more about the family and what is it exactly that we can support them with. A lot of times our families have no other support, no other connections, no other resources that are supporting them, and they don't even know what they need themselves. They just know, I have a child and I need help. So we learn a little bit more about the family, and one of the most important things that we're going to keep referring to is culturally responsive support. A lot of our families don't speak English, and so our service navigators all speak the languages that our families speak. So Arabic, Urdu, Farsi, Somali, Bengali. You want to say it?
There's so many.
Yeah.
And it's such an important piece, right? Because we live in a country where we are supposed to be providing culturally responsive supports. But if you're familiar at all in any extent with the healthcare system, it's really, really hard to navigate, specifically for children with disabilities, with special needs, with any kind of health condition. To be able to navigate the technology and the language, it's very difficult. And so for us, it's so important for these families when they meet us, for them to know what their child is getting referred to or what options they have. And if they have a good understanding, it will empower them to be able to make decisions, because at the end of the day, the child and their family, their parents, their caregivers, they're the ones who are the decision makers for this child's life. It's not us. It's not anybody else. So, that is such an important piece. And like Raian mentioned, we often talk about that piece because it's often overlooked in mainstream services. And as a result, we know statistically from the 750 some families we support, many of them come to us without any funding, without any therapeutic supports, without any resources. And we have to ask why. If they're residents of Canada, why don't they get anything? And is it because they don't want it? Well, 99.9% of the families we meet do want support.
Of course, they're looking for it.
They're looking for it, but they don't get it. And, there's a lot of systemic barriers that are preventing access to services. And this is why that second piece, research and education, is also very important. Because one of the things that team does is to educate not only families on what's out there, but educate service providers on how to engage families, how to support them, how to educate them on resources and support so that they have a fair shot Everyone at Smile has one goal, and that's to leave no child behind,
That's awesome.
to give them access, so that they can be. We have this we have this thing that we're always saying at Smile, and that's, it's not that we're looking at children specifically because they're our future, and we're not looking at children because they're going to be the ones to take over. We're looking at children being children because they're children, right? It's not so much about the expectations we have on them or what we hope for them to achieve. They need to be able to be kids first and foremost, and we need to provide them with the supports to be able to do that. So for one child, that might be playing. For another child, that might be learning. For another child, that might be feeding independently, eating independently, toileting independently. Whatever it is that child needs to do, they should have the same right and opportunity as you and I when we're living in this country.
Absolutely. That's a very good point. I mean, you've referred to the child. We live in a first world country, right? The great thing about Humaniti, of course, is we work in 17 countries. And often when we speak to donors outside of Canada, they're stunned that there are needs in Canada, right? And so I think one of the things that I want to hear about is that as we talk about how you build relationship with these children, with these kids and their families, how you build trust, how you deliver service, is talk about a little bit, if you could, Sukaina and Raian, around the fact that, so some of the myths around the fact that when you're living in a first world country like Canada, for us to be able to go and access services for my child, say, is on the spectrum, or my child who has trauma, how challenging it is, right? And most people, from this part of the world, listen, we hear about mental health a lot. Everyone talks about mental health, right? But this is beyond that, right? Mm-hmm. You tell me, you guys are the experts.
Raian and I, we had gone to a meeting once, and the stakeholder that we were meeting with, we were sharing a story about a newcomer from Sudan that we had met, a family in a hotel. And this individual stopped us in our tracks, and he said, wow, they're so lucky. They're so lucky. They got put up in a hotel. And Raian and I, addressed the situation that they're not lucky. This is a family from Sudan, a family of 7 who had come to Canada through a settlement agency. They were in a single bedroom, a 1-bedroom hotel room for about
almost 7-8 months.
7-8 months. They had a child with a disability that required mobility equipment, things that would make the child, really, that would change the child's life, have a commode at the toilet so the child could toilet safely, take a bath safely. This is a family of 7 in a 1-bedroom hotel room for 7 to 8 months with no disability supports, no physical support. It's not at all lucky.
Yeah, absolutely.
Right? It's not at all what it might sound like to somebody who might be unaware. And the thing about the system is when newcomers come into the country, they first have to find a place of residence, a place to reside. Once they find a place to reside, then they get access to a primary care physician. But there's a shortage in Canada of primary care physicians. As we all know, for those of us who've lived here for some time and who access services, you cannot get any type of specialty services, including any type of pediatric services, unless you get a referral. Yeah. Most of the families we see don't get access to services for years. And so what happens is their mental health doesn't get supported at all. Their physical health also doesn't get supported. Instead, we're relying on an emergency room system, which is not at all what we should be doing.
Of course.
Right? And so oftentimes when we're meeting families, we're meeting them not only after they've endured so much in refugee camps, we're in coming as refugees and displaced persons, but also that there's been a lot of regression since they've come here. So, I think sometimes what people like the narrative around how it appears and how it is in reality is very, very different. And for us, from where we're sitting in the conversations that we have, oftentimes it's educating people on, no, this is what you might think the system is, but in reality, for newcomers, it is very difficult. Oftentimes when we're sharing, we say we might have taken one step forward, but 1,000 steps back. And so for families who come here after they've waited years to get services, it's now looking at the regression on the child, whether it's physical health or mental health. It's now working on also trying to make up all that time, which, as we know, for children, it doesn't work that way.
Even for the resources and supports that are available, there's a lot of restrictions. It's not very open. When it comes to our families, applications, for example, to apply for government-funded programs to support your child are only in English. If the family doesn't speak the language and they don't even know how to access that resource, how are they able to apply and get that support for their child? On top of these government-funded programs and services, the wait list is about 3-4 years long, depending on where you are in the city as well. If you're in Toronto, you can access specific services that are only available for York region or only available for Halton region, and vice versa. So there's a lot of restrictions at place that continue to put more and more barriers in our families' ways, and that's what we're here to do, kind of just help break down those barriers.
I mean, it's a big part of it, right, is the advocacy, right? The education advocacy, right? And you mentioned that there's a whole area dedicated to that at Smile, right? It seems to me, as an outsider looking in, right, we, as a Canadian, so Canadians that have children or relatives who are, have challenges, difficulties, disabilities, whatever the case may be, accessing services has its own level of difficulty. And then now the demographic that you're serving, newcomers, that's a completely different world, right? So how do you guys, you talked about, culturally specific, the language. I mean, so how are you navigating dealing with a newcomer who's come, say, from Sudan, as an example, from a war zone where, civil war, if you will, all the trauma that they've experienced, and they've come to Canada, right, a safe haven, and realize that it's, okay, it might be safe, but it's a difficult world to navigate, right? And so, for you and for your healthcare kind of colleagues, how do you bridge that gap with building that trust? I mean, how is that you really get these families to trust you, especially the children? And can you really advocate for them? And I suspect, every family is different. So it might take one family a year or 2 or 3 to kind of get them through, whereas others it might be, at a different time frame. So just so we can understand, what does that look like? How do you actually do that?
So when it comes to family support, I mentioned one of our first steps to meeting a family is a needs assessment.
Yes.
And so you're learning a lot more about what the family's needs are, what the child's needs are, and what the family situation is. And because these conversations are happening in that family's language, there's an immediate bond right there. There's an immediate trust there as well, because a lot, like Sukaina mentioned, a lot of these families, we're not meeting from the very beginning. It's not an early intervention process. We're meeting them when we're in an emergency situation where the family has exhausted all resources, they waited years to receive services, and they've finally been referred to us. And that's something that we've been working on over the last 2 years, is that early intervention. So that immediate bond and trust is built from there. And then our service navigators do something called wellness checks. So as they're providing our families resources, they also check in with the families like, hey, how's everything going? How is this resource? Is it working for you? Do you need me to refer you to someone else? Is there anything else you need help with? Because a lot of times there is that stigma in asking for help. So our families don't reach out to us sometimes. A lot of them do, but some of them don't. So we need to make it a point to also reach out to them. And that continues to further increase that bond and keep them satisfied with the support that they're receiving at Smile that they're not receiving from anywhere else.
And it's about listening to their story, right? When you go into the doctor's office, there's usually a note put up that said only one concern at a time, right?
Absolutely.
But we're interconnected beings, right? Like our mental health is related to our physical health. Our physical health is related to our nutrition. What's so interesting is we meet so many families who don't have enough food to eat. And then if we're talking to them about learning, for example, we're talking to them about how their child's learning. And we find out that they don't have enough food to eat. There's a direct correlation between, having the adequate, nutrition and sleep and same thing with mental health, right? And so at Smile, it's a huge part of it is actively listening to their story. In Canada, what often happens is we listen to one story from when they've entered Canada. And so, even in terms of what doctors have prescribed in previous countries, what healthcare they received, oftentimes families hear, "Oh, no, like we don't really count that. We need a new assessment, or we need something that's updated from the Canadian context." And while there are reasons for that, their story never started in Canada.
Yeah.
These are stories of displacement, stories of, people fleeing violence, stories of families living in refugee camps for long periods of time. That impacts a child. And so if we don't pay attention to what a family's been through, what some of their cultural differences or preferences are, the language that they speak, we aren't actually going to be able to support them. And so we spend a lot of time getting to know families. We have social events, recreational events, where sometimes we're just, having a good time. Like we have different programs that involve sports and food. And we make sure that all of those are as culturally responsive as possible. So, for example, even what we serve in terms of food to our families, they should feel at home.
Of course.
It's really important because at the end of the day, our hope is to support the child and by extension, their family, and by extension, their community. Because at the end of the day, we want these children to feel as safe as possible in their communities, with their families, so that they can flourish. That's the goal.
That's amazing. I mean, that's, the reality of it is, because I want you to talk about stats in a moment, right? The reality of it is that it's just the tip of the iceberg, right? I mean, you're touching something so personal to them, right? Especially that demographic of just having arrived in Canada. I've been in Canada for a while and struggling with just the cultural kind of practices here, if you will, right? In terms of access to services. So, I mean, that impact is something, anyone, listen, I'm a father of two. You're a mom. One day she'll be a mom, inshallah, God willing, right? Anyone who has a child, you know what you would willing to do for a child. If it's, my son's been sick all weekend, and it changes your whole persona. Like you try not to let it bother you, but it bothers you, and it's small. It's something, it could be just a flu or a cold or whatever, but it takes you off your game. Imagine, right, as you see, and as we've experienced in the global work that humanity does, people are coming from war zones. They're coming from a place where there's been forced migration. They're coming from destructive backgrounds. They're just coming from a place where, safety, security is just not something that they have. And they arrive in a country like Canada, first world country, and they realize that they still have to advocate and fight to get to what, So, I mean, so what I'm interested in learning a little bit now about, so what services do you provide? Like if you can kind of high level, here's what does Smile do? What does it do for people? We know about the connections, and then if we can talk maybe a little bit about the program that Humaniti is supporting, tell us a little bit about that program.
So in terms of services, the service navigation piece is the caseworker piece. That's the piece that happens behind the scenes. Once we get families connected, once we learn their story, connecting them with resources, helping them fill out funding applications, trying to access those resources in the community and in healthcare disability spaces is the bulk of the work. However, it doesn't stop there. There are also programs that Smile offers to children and youth. So some of our youth programming, for example, is around, building skill, making social connections, engaging in different recreational and professional activities. Right now, we have a wonderful entrepreneur program where youth with different disabilities, they're starting up their own businesses. They're getting an online presence. They're meeting connections. They're exploring their strengths and their skills, and then they're giving back. We have another youth program where youth are getting involved in projects that are giving back to their communities. And one of the ideas behind this program is that families identified that youth, their children, their youth, they're part of different cultural and faith spaces, even neighborhood communities, but they're not known. Nobody, when they walk down the street, nobody says hi to them. A lot of people don't believe or expect that they can give back or they can be an integral part of the community. And we know that that's not true.
Of course.
Right? Regardless of ability, regardless of skill, we all have our place. But sometimes, the society we live in, we don't always give people a shot because we assume that there's nothing for them to give back. And that's not true. And so part of this program is really helping youth, supporting them and helping them identify their skill. The piece that Humanity's involved in is probably one of our most critical programs. And that is where we have this project where newcomer families, especially after we first met them, we identify an area that the child is really struggling in. For example, the child is struggling with mobility. The family has shared that they don't have access to any services. We know that there's no funding available for the child, for example, to get physiotherapy. And we know that this child has regressed. So after a full assessment, we actually link the child up with a qualified registered physiotherapist. And the impact on direct service, the impact on the child and on the family and on the child's future is something that you can't even put a price to or a number to. And the reason why I say that is because for a lot of our families, their children have regressed, but they have the potential to improve, right? However, if we leave it too long, if we wait too long, it's more and more difficult for them to improve. A major area for us is mental health, as we mentioned, and so addressing trauma in children. Unfortunately, right now, with settlement services, it's not a priority. So settlement agencies will do a physical assessment of a child. They'll check for communicable disease. They'll make sure children are vaccinated. They'll make sure that they're up to date in their vaccines, that they have a physical wellness check. But these don't involve mental health unless it's an acute episode. Talking to a child about what they've seen, what they've heard, what they've witnessed. Especially a lot of what we're doing is talking to a child about what they've experienced in terms of grief. This can sit with a child forever. And if it's not addressed, we know from a health perspective that it impacts how they learn in school, how they develop social relationships, how they take care of their own physical health. So it's really important for us to address it. With the funding for Humanity, we are able to pay for therapies for children and then meet those critical and essential needs. These are qualified registered therapists who have the expertise, but it's not only an expertise from a health medical perspective, they also have that cultural responsive background where they can really make connections with a family. This is what Humanity is helping us with. And honestly, we talk about impact and we can talk about stats and numbers, but really what we've heard from families is it is life-changing. And I know it's a bit taboo or cliche to say that, but it really is life-changing.
Speaking of that, so you've seen it firsthand and your team has seen it firsthand. And for, folks like us looking in from the outside, what does it do for a child? Like, what does it really, let's say, you've onboarded, a family and you've provided services. I mean, what have you done for that child? How have you changed providing the opportunities for that child to live to his or her fullest potential? Like, if you can just articulate that a little bit, I think it's, cause when we think of, I just think of, we're about to go on another global field trip for Humanity. And we're going to be going to places where, it's a challenge to see the kind of the situation of people. And I remember a year ago, I did a similar trip, and I was blown away. Me personally, I was inspired, humbled, blown away by the capacity of the people I met, and especially the young people. If you removed where they were and their circumstances, they could have been anywhere in the world.
Yeah.
That potential was there. And I that to me was, as a father of two, that was incredibly important for me to see. And that's the kind of thing that Humaniti is, of course, focusing on, is how do we provide opportunities for, communities and individuals to live a full life, right? Live a purposeful life, live a meaningful life, and as best as we can with our partners. So maybe if you can briefly both of you can touch on, what is it that you're doing for them? What is it that you're instilling in these children and their families that really changes their trajectory? If you could.
I'm going to focus on the families piece.
Sure.
Just to start off, I think a lot of times because of the lack of support that a lot of these families have received from their journey arriving to Canada and trying to support their children or their youth, they start to feel hopeless in receiving that support. And then, like Sukaina mentioned, there's a lot of regression as well when the child isn't receiving support. So the family, there might be even stigma or misinformation about my child doesn't have the ability to do this. My child doesn't have the capacity to do this. This is his limit. He can't get farther than this. And so I think with the kind of supports and resources that we offer and the types of programs and the types of funding for therapies and any other sort of accessibility accommodations that we can provide to our families, you start to see that not only is the child progressing and surpassing these milestones that the families or the barriers that the families thought that the child would have. But you see that the families also themselves have expressed to us, like, I did not know that he had the capacity to do this, or I didn't know that this was something he could do. And you can see how much of a champion they become for their own child. And then that also inspires them to be an advocate for their own child as well and not put limits on their child. And then they also come to us and say, after this program is done, I would like him to do this. How do I do that? Or, I want to connect him to this resource. I want him to work here, or I want him to volunteer here, or I want to connect him to so-and-so. And you start to see that they're planning a bigger and better future for their child as well. And that's where kind of we come in and we continue to support, and those dreams and those goals keep getting bigger and bigger.
It's amazing. It's amazing.
And they've always had those goals. It's just that, somebody's told them no.
Yes, of course.
Over and over and over again.
Absolutely.
Right? Like, parents, caregivers are the biggest champions, advocates for their children. And sometimes, after being told that they can't do it, or they'll never improve, or they'll never get help, or they'll never, like we have so many specific examples. One that I can think of is there was we connected a family to some, psychotherapy, pediatric mental health supports. And the child was really struggling with not speaking. And not because the child had any physical inability to speak, but because of trauma. Because of the trauma they faced, the child was not making vocalizations, was not speaking verbally. And the parent said, I know that they can speak, because I used to hear them speak before.
Wow.
But slowly, the child has become so secluded, and there's a lot of grief. And we hear this, right now, what's happening around the world. We hear these stories. These stories have become more public. I feel that we've become more aware to the impacts of war, of structural violence on children, and how there's a direct correlation with disability and with health. And this child ended up engaging with a pediatric therapist, and this therapist is qualified and skilled to support the child. And slowly, the child began opening up. The parent in this situation is hopeful that the child will open up even more and not necessarily get over grief, because I don't believe grief is something that we get over instantly or immediately or even after years, but learn to live with grief. Having a child lose loved ones, anybody lose loved ones, lose community members, lose homes, lose, family, friends, it is going to impact a child. And for a parent to see that my child can laugh, my child can express joy, my child can have a conversation, you can't quantify that at all, right? And one of the beauties of Smile and even being in the positions that we are is we get to hear firsthand those parents come to us and say, oh my God, do you know that so-and-so spoke, or so-and-so took their first step, or so-and-so? The number one compliment or comment we hear is they made a friend.
Amazing.
Right? And sometimes when we share that, people say, well, like, we all have friends. No, we don't all have
correct.
friends.
It's true.
Not all of our children can identify a friend. Not all of our children get invited to a play date or to the park. And so for a parent to say they've made a friend, they're having conversations, it's a really, really big deal.
That's amazing. I mean, full disclosure, I followed Smile for a few years. Really inspired by the work that you do, by the work that the organization does. And I think a big part of it, now that I'm meeting you, I think maybe we're meeting for the first time, or maybe we've met somewhere, but the fact is, this comes from a place of, like you said, when you say about, some of the milestones, like I made a friend, for people who've been around kids who struggle with these things, that's a big deal.
It's a big deal.
And the fact that, these milestones, we never see it. We never hear about it, right? The families, they experience it firsthand, and they're able to share with that. So, like, what is the need out there today? Smile obviously has been around for some time. I suspect there's other organizations doing similar work, right? What is the need out there today? And the way I want to frame that is that we know what you do. What is the gap? Everyone needs money, of course, we get it. But if you could tell us, because that's not an area that most people are familiar with, like, so the refugee demographic as an example, how many kids out there, families out there are in need of this service? And first of all, don't know that services exist, don't have someone who can advocate for them. But maybe they come across Smile, which is our responsibility, Humaniti, is to make sure that everybody knows about the great work you're doing, of course, and try to expand the work. But what does the stats look like? We know about mental health now because everybody talks about it, obviously, given the context of the world that we live in today, right? Everyone's touched by it. Every single one of us is touched by it. But for a child, it's a different level, right? So what is the need that, as you see today?
So one of the things that I'm not sure if it's common knowledge is that newcomers coming into Canada, there's a stark difference between newcomers as new immigrants and newcomers as refugees, asylum seekers, evacuees. For the first category, we still exist in a point system, in an immigration system where, having a disability, having a medical illness, having a long-term health condition sometimes actually prevents people from entering the country. When it comes to refugees, evacuees, asylum seekers, it's a little bit different in that sometimes, given your situation, that's actually what helps you get into the country. Most of the newcomer refugee children who have been displaced, children who have experienced forced migration, we're seeing the level of disability and health conditions impact them much more. Put that aside for a second. The impact of developmental disability on children, the stats now tell us 1 in 3. 2 decades ago, it was 1 in 5. A decade ago, we were seeing 1 in 4, and now it's become almost 1 in 3. So if we put those two things together and we see, okay, approximately 1 in 3, let's even say 1 in 4 children are impacted in general by pediatric disability. We're talking about children are experiencing learning difficulties, developmental difficulties, difficulty with cognitive ability, physical health, and the list goes on, sensory processing, self-regulation. But now we're also seeing that there is more children who are coming into Canada who have now experienced the disabling effects of war, of famine, trauma, extreme poverty, and the list goes on. So from our end, more and more and more, like we're looking at such a high population. Now, it doesn't mean that they all have to come to Smile. That's not what we're saying. But we know that the need is really, really high. We know that need of pediatric health and disability is higher now than it's been ever before. Most recently, the Government of Canada's statistics for newcomers, before it was 24% of our general population, it is expected in 2024 to hit 30% of our population.
Meaning what?
Right? So the population of Canada, almost 30% are now newcomers, right?
Wow.
So where does this conversation, while it is such a critical conversation to have, if we're looking at the numbers, it's an even more critical conversation to have, right? Because we know that it's impacting our children, right? Either which way we look at it, we know that disability and health and the newcomer experience is impacting all of us, whether we're talking about the children who are in our children's, our child's schools, parks, libraries, shelters. The other thing we know is newcomers are experiencing more and more of a financial barrier. So why am I saying that? Because we know that health is expensive. Even health in Canada, we spoke about it earlier, is expensive. And we know that the financial situation for many people, like we're sitting in the Greater Toronto area, housing prices, rent prices, food prices, gas prices, it's expensive. What we unfortunately see as Smile is parents have to choose between putting food on their table or providing a critical, meeting a critical need of their family. And that's not a fair choice. That's not a choice that they should have to be making. So this is really where now we come in, right? Where Humaniti comes in, where your donors, your friends, where Smile comes in, where our friends, our stakeholders, where we're trying to say it's not an us problem. It's not a Smile family problem.
Absolutely.
It's a we problem.
100%.
It's a community problem. It's something that we all have to get together and work towards, fighting, advocating, stepping up, however which way we look at it, however we phrase it. It's a problem that impacts every single one of us.
Absolutely. Did you want to add anything to that?
I did.
Yeah,
From an organizational capacity as well, the gaps, for example, when we talk about early intervention, so when a family comes through a settlement agency, for example, or goes to their family doctor or ends up at Sick Kids Hospital, for example, if there's a specific need that related to that organization, that need is addressed. But all the other needs are not addressed.
Yeah.
So for example, at Smile, we have families who during the needs assessment, we find out, okay, yeah, sure, they need XYZ support in terms of disability related supports, but the family is also not receiving any kind of, both parents aren't working because let's say, for example, mom and dad are just unable to work because their full care is with the child, or one of the parents has an injury and is unable to work, but they're also not receiving any social assistance. And because they're not receiving social assistance, then they have to make those decisions of, am I going to pay for my child's support or am I going to pay for food on the table and rent? And then when they are referred to someone like Ontario Works, or they're referred to an agency that can support them, only that specific need is addressed. So if a family is experiencing homelessness or is about to be evicted from their house, how are we as an organization supposed to support them in linking them to therapies and disability-related supports if the first need of shelter and housing security is not addressed? So I think a big gap in our organizations is there's not a lot of collaboration with the bigger organizations in terms of how can I support this family in a holistic manner, which is one of our main focuses is at Smile. We're not very well versed on housing. We're not very well versed on quite a few things that have nothing to do with disability, but those are the things we need to target first before we think about disability. And that's where our advocacy comes in. That's where we start reaching out to these organizations and say, this family needs help. This is what they need support with. What can you help them with? And how can Smile help you help them? So that we're able to tackle the issue of disability-related supports that they might be needing.
Amazing.
And an example of that is we got a referral from a family who had a child in critical care at the Toronto Hospital for Sick Children. And we also knew, because it's a family that we support, that the family's homeless. And so the child and one caregiver is at the hospital for an extended period of time, but the other sibling and the other family members are actually accessing support from a local shelter. And, it's really, really important for us to understand as a community the impacts of homelessness on a child's health. And so, unfortunately, the way the system is, while the child was getting acute medical care, the institution or any of the hospital institutions, they're not required to provide housing support.
Yeah.
They're actually not required to give you food to take home to feed your children. And this is a systemic issue. And while we're not saying we can solve the systemic issues, what we do feel is that if we collaborate with other organizations, if we also raise awareness and address some of these issues that impact our families, then we will collectively be able to come up with better solutions.
100%. Listen, so much of what you've said today resonate with me and resonate with the organization, right? So I want to touch on a couple of things as we wrap up. First of all, thank you so much for giving us a window, opening up that window into the world of the work that you do. As a proud Canadian, I've been fortunate to travel the world, and usually I travel with the Canadian flag somewhere. Like there's a Canadian flag sticker somewhere, right? People identify you as Canada. And of course, beyond, where are you from? Canada? Oh, Toronto? I know such and such. Do you know the person? Of course I know them, right? Because they expect that you know all 40 million Canadians. But if you go back to that stat you mentioned, 30% of that 40 million, 12, math is my thing. So 12 million Canadians are newcomers, right? 1979, I was a newcomer. Yeah. My parents left British Guyana and they migrated to this country with 11 kids, right? For a better life for us. They didn't have to come here, but they came here for us. And I think of where we sit today, and I've been living in the same community in the East End since 1984, and I've seen how that community changed, and I've seen the demographic of that community change. The reality of it is exactly as you said. When we come in Canada, in a first world country, we have lots of struggles, and agencies are singly focused on trying to deal with certain things. The fact is we have to deal with all of the challenges of a family, right? It's got to be a comprehensive, it's got to be holistic, which is what Smile is trying to do. Identify all of the needs because it affects everybody and absolutely has an effect on that child, right? So, something that of course Humaniti is very involved in is food security, right? And we know how many Canadians are food insecure today. Like the stats they're outrageous. Yeah. And then of course, and a good number of that is not just, of course, the newcomers, but the average everyday Canadians who've lost their jobs, had health issues, the COVID, the list goes on. So, for a newcomer coming into this country, you just add all these layers and levels. So, of course, it's extremely difficult. And if, like the symptom is, we're just dealing with the symptom of that and we're not dealing with everything else. So, first of all, it's inspiring to me to hear the way you go about the assessment and the fact that you're taking that comprehensive approach. Ours is a model of collaboration. I mean, anyone who's heard me speak about Humaniti, the reason I'm here, the reason Humaniti exists is not to build another organization. Humaniti exists to bring organizations together, to connect them such that we can have that impact that you're talking about. So, I think, from what I hear, we're perfect for each other, as they say. We're thrilled for the opportunity. We're obviously going to talk about how beyond this immediate program that we're supporting of being able to provide services to families and to kids in particular, how else we can support. Your point that you made earlier about, that how do we navigate and connect to the agency such that we know where we can send people. That's something that Humaniti is very committed to. It's something that we do locally and globally. And so we'll explore some of those navigation, if you will, with Smile. But really, for me, this has been an eye-opening experience. I've been following the organization for a while, but I've kind of gotten distracted the last few years with Humaniti and the work that we do globally. But one of the things I can pledge is that as an organization, we will work very closely with Smile to try to fill some of the gaps that you have in terms of just coordinating with other agencies, because we work with a roster of agencies, not just globally but domestically, and housing and healthcare, and the list goes on and on. So I just want to thank you for this. I think this has been for me incredibly informative and very inspiring. We're thrilled for the opportunity to work with an organization that really at the end of the day is focused on something as simple, and I think of my own two boys when I think about that, just for the kids to be kids. Yeah. I think that is, in this day and age, in the world that we live in the context of the world that we live in, I've said it often, I'm going to say it again. We're trying to find our humanity. It's in our name, but we're all trying to find our humanity. And it starts with our kids, right? Yeah. Let kids be kids. So, I just want to say, congratulations on the great work you guys are doing. It is our honor to be able to partner with a great organization like Smile. We hope that, God willing, we can expand the work that we do with you. We will advocate for you. You can count on that. And for your kids, right? Such that they can have those opportunities that, our parents sacrificed for. So thank you guys. Thank you for coming out today. I don't know if you had any last comments, but, we're thrilled for the opportunity. And this is an area, of focus for humanity, the health care space, and in particular mental health, and being able to advocate for those who are really looking for opportunities to participate in the society. And in Canada, we pride ourselves that we care. Care for our neighbors and compassion are two of the founding principles of humanity. Collaboration being another one. So all of these things are embodied by Smile. So I just want to thank you on behalf of the organization for the great work that you do, and we're honored to be able to support it in a very small way.
Thank you for having us. These are the conversations that we need to have as an organization as well, to educate the public, and having these conversations and these collaborations and these connections is the best way to do it, to support those who need it.
Absolutely.
Yeah, I agree. I think when, we started this conversation by saying, where did we come from? And how did we start? And what was our origin story and all that? And I think the difference that I've seen from then and now is, we are now more public, sharing, sort of this struggle that we have, and of course sharing the struggles of our families. And one of the most fascinating or most impressive things for me is when we first started, it was such a taboo conversation, and now more and more, like you mentioned about mental health, is we're able and we're willing, but we're also invited to have these conversations. And so, from our whole team and the families that we support, thank you for that, because it's so nice for us to get the email that says, can you come and have this conversation, when it's not a disability organization or it's not a hospital. Usually we're speaking to other therapists and other clinicians, and it's getting this conversation out into the public that is so important. So thank you for that, and thank you to your team as well.
No, thank you. Thank you, Sukaina. Thank you, Raian. Thank you for being here today.